Good morning. Very pleased to have present in her office here in Southern California, Dr. Heather Roberts. Thank you for having us, Doctor.
Thank you for having me.
And she's active in the USC Keck School of Medicine, and as well as UCLA, while maintaining obviously a very, very busy clinical practice. She's nearly a decade or so, since 2013 with InMode.
2013, yes.
And she's probably the most experienced clinician with the IPL technology developed by Mishka Crandall, the CTO of InMode. And she has tons of experience. And
Great. Thank you so much for inviting me, Dr. Chia, and thank you to InMode. So today we're going to talk with Christine, a busy working mom, physician, and mother of three, who's looking to freshen her skin. So we're going to just talk a little bit about what she's hoping to achieve with the LUMECCA photofacial rejuvenation procedure. How are you doing today, Christine?
Great, thank you for asking.
Nice to see you. So tell me what you're hoping to achieve and what you want to address today with LUMECCA.
Well, over the last year, I think all of us have been under a lot of stress, and I've been spending more time outdoors as well with my children. And I feel like I've really accumulated a lot of pigmentation, especially in the cheek area, my temples. You know, the texture of my skin isn't glowing.
Okay.
I would love to feel refreshed, still like myself, but you know, a more healthy looking complexion.
Great, perfect. And you've never had any laser procedures before?
I've never had an IPL, no.
Okay, all right, wonderful. And so when you go out in the sun, tell me what happens with your skin. Will you burn and then tan, or do you always burn? Tell me what your skin is like.
I'll definitely burn if I'm not wearing sunscreen.
Okay.
And then it will turn into a tan probably for a few days. But yes, I burn first.
You do, okay. And I'm sure you're always wearing a hat and sunscreen when you're out.
Yeah.
And so with your children, how much sun exposure, like just so I know in terms of my settings and how aggressively and non-aggressively to go, what do you have coming up in the next month or so for outdoor plans or trips?
Well, usually I'm outdoors on the weekends for a few hours, but it's, you know, protected, of course. I don't have any big trips coming up
Okay.
in the summer, maybe
Great.
not until July.
Okay, fantastic. And are you on any medication right now?
No, I'm not.
Okay, any allergies to anesthesia or any medication?
No, not that I know of.
Okay, perfect. And then have you ever been on any immune suppressing medications or Accutane?
I did take Accutane one round in my 20s.
Okay, all right, nothing recently?
No.
Okay, perfect. And no other medical issues, sensitivity to the sun, thyroid problems, diabetes?
No.
Any problems with healing or scarring? No?
Thankfully, no.
Okay, and when you were pregnant, did you ever get melasma or the mask of pregnancy?
No, I think my freckles got a little bit darker,
Okay.
but that faded after about 6 months.
Okay, perfect.
Yeah.
And nobody in your family that's had melasma?
No.
Okay, wonderful. All right, do you have any questions for me?
I was just wondering what kind of downtime I can expect.
Okay, sure. So basically, before you leave today, after we get done with the treatment, you're going to see your brown spots are already turning a little bit darker. That's my endpoint.
Okay.
And so I always say they look like little baked-in coffee grains. It's not going to feel so much like crusting and peeling as much as just feel like it's baked into the skin. And so with all the aftercare that I'm going to give you, you know, you're just going to do the gentle aftercare. Don't pick or scratch them off. Typically, they will fall off within 5 to 7 days.
Okay.
And you can cover it with makeup as early as tonight if you needed to.
Okay.
All
And
right.
then how many treatments do you think I'm going to need, and when could I come in for my second one if I
Right,
wanted to?
right. Great questions.
Yeah.
So, you know, typically, again, with the first treatment, you're going to see at least a 90+% improvement in your brown spots. Sometimes, you know, if there's a couple little brown spots that remain, we'll do a follow-up second treatment in 4 weeks. Blood vessels and redness are a little bit different. So because they're really more like living, breathing structures, they often can take anywhere from 3 to 4 treatments, sometimes 5, depending on the patient. But I mean, you have beautiful skin. So looking at your skin, I mean, probably 1 or 2 is going to be plenty. And then maintenance, like, you know, you're going to continue to do all your good skincare and sun protection, and it might be something that once or twice a year you want to, again, freshen things up, because it does give a really nice glow to the skin as well. It'll make light reflect off your skin in a much healthier way. and even maybe a little pore tightening. A lot of patients will notice a little bit of collagen stimulation, so the skin feels a little bit smoother and the pores can look a little bit tighter. But yeah, this is my favorite procedure. I mean, patients really, it's like, you know, it's very predictable and patients are very happy with results.
Great.
Yeah, great. Let's get started.
Okay.
And so we want to treat the skin delicately. You know, no chemical peels, microdermabrasion, retinol products, Retin-A, tazarotene, anything that would be excessively exfoliating. Some patients, if they're getting, you know, a little bit antsy about how soon the brown spots will come off, after maybe 3 to 4 days, I will let them use like a Clarisonic device or some other like ultrasound rotating brush if they want to. But, you know, for Christine, I mean, she'll be fine with just a gentle cleanser and the elastin twice a day for the next 3 weeks, and then some chemical-free sunscreen. So we're going to use a little tinted chemical-free sunscreen on her before she goes. And the reason that I really like the chemical-free sunscreen is, you know, to avoid any potential irritation from, you know, the chemicals that are in chemical-based sunscreens. And, you know, we're learning more and more about the effects of visible light and near infrared and blue screens and computer light on pigmentation in skin types 4 or darker, even some 3s, and worsening of melasma, whereas in lighter skin tone, type 1 and 2, that visible light can cause more redness and worsening of rosacea. So if you think about what we're trying to achieve with the IPL, we're trying to fix pigmentation and we're trying to fix redness and rosacea. So again, that's why I like tinted sunscreen. And so if the sunscreen is visible, meaning it has the iron tint, then it will block visible light. Just a white sunscreen won't. If patients don't want to wear a tinted sunscreen, then I'll at least have them do a chemical-free, non-tinted sunscreen with maybe a little dusting powder with some iron pigment in it. But yeah, so this is great. I mean, she can go out tonight. She doesn't look like she's, you know, had anything done that's scary. She can go home to her kids and you know, enjoy her weekend. All right, well, thank you so much, Christine.
Thank you.
Great. All right, so we're going to get started with lovely Dr. Christine, and we just washed her face, and so now we're just going to prep her skin, and I like to do a really nice prep as long as the patient's skin is not too sensitive, with typically like a combination of alcohol, some Hyclodex spray, which is hypochlorous acid, and even sometimes I'll mix in a little Zephyrin as well. I am noticing, Christine, that I didn't realize that you had a little microblading on your brows, right? Okay, so really important to, you know, screen for any lip tattoos, any other cosmetic tattoos. I mean, you would avoid the hair-bearing area anyway because we don't want to, you know, singe the hair or cause some patchy hair loss that could be permanent. So we're going to stay away from the brows, but, you know, especially knowing that they have a little bit of a tattoo, I'm going to definitely stay away from the tattoo at the edge of her brows as well. So I'm going to go ahead and just start cleaning up her skin. And, you know, we try to have patients come in with just their sunscreen and not a lot of heavy makeup and no mascara when possible, so the mascara doesn't flake down into the gel and then you have to stop and clean up and restart. But, you know, often patients do come in from work and so they may have on makeup as well as sunscreen. So always be really good about cleaning and prepping the skin. You know, there has been some studies showing that even with non-ablative lasers, you can get a staph infection. You know, some people do harbor staph around their nose, and if people are not, you know, cleaning their makeup brushes so well, but, you know, definitely you'd want all the makeup and sunscreen off of the skin so you don't have any tint, competing pigment, anything to irritate the skin or spark the skin, if you know, because a lot of the sunscreens have iron and titanium and zinc in them. So I just, you know, do several passes until I'm seeing a nice clean area. And she's got great skin, so I don't have to do a lot of cleaning. So when we treat men, one of the things that I always ask about is whether they, you know, like to have a close shave all the time or if they do like to be able to grow some facial hair. because again, since, you know, this laser has overlap in, you know, pigment is the chromophore that we're looking for, the brown pigment, and, you know, as well as red, but hair has brown pigment in it as well. So if a guy, you know, comes in and he's like, no, I always have a clean shave, or I don't care if I get some patchy hair loss, it'd be great getting rid of some of that hair, then I will treat the whole face. I'll always have them shave the morning of, and if they come in and there's even a little bit of stubble, I'll shave them again before I start, just so I don't singe the hair onto the skin. But for a lot of men, it's really nose, cheeks, and upper forehead, and that way they can decide what they want to do with their hair pattern down the road. So I'm going to put her goggles on. So everybody, you know, always have protective eyewear. So I'm going to put little laser goggles on her. Christine, go ahead and just hold those on your eyes for a minute, and I'm going to adjust the button. And I'm going to slide it down so I don't poke you in the back. Is that okay?
Mm-hmm.
Not too tight?
No.
Okay, perfect. And then I'm going to put my goggles on as well. So in terms of her settings, so from what Christine has told me, when she goes out in the sun, she's, you know, a type 3 skin type. And so, you know, again, with Asian skin tone, there's a big range. So, you know, some Asians have very light skin, medium to darker skin, and even sometimes in a lighter skin Asian patient, you know, they still have propensity for hyperpigmentation or melasma. So I'm always super conservative, especially the first time I'm treating someone. So we're actually going to start with a longer wavelength filter. So that's the 580 nanometer handpiece. So, you know, when we talk about, you know, how to select which handpiece, first thing is you assess the patient's skin type. So if they're a type, you know, 1 or 2, and they don't have any propensity for melasma, then I will definitely use the 515, which is the shorter wavelength. A type 3 Asian type or Latina skin, I'm going to probably start with a 580 nanometer, see how they respond, because melasma is really one of those really tricky things, because, you know, heating the skin can actually make melasma worse. And so even though initially the patient's going to love you because it's going to brighten up immediately, then as it comes back, and if it comes back darker, they're really going to be upset. And so, so for that reason, I think with the first treatment, it's always best to be really conservative. So we're going to put a refrigerated clear ultrasound gel on the skin, and that's for both to protect the epidermis as well as to give her some additional cooling comfort and to make a really nice connection between the sapphire crystal on the tip. And so this is, you know, more of a contact crystal cryogen cooling. Some of the lasers, you know, have more of a liquid nitrogen spray. For cryogen, this is a contact between the sapphire crystal and the gel. And so the nice thing with the LUMECCA device, go ahead and just turn this way, Christine, is that, you know, the spot size is 1 centimeter by 3 centimeters. So you get this really nice, you know, 3 centimeter square area that we're going to march across her entire face. So we'll get a nice full face treatment without any gaps or, you know, any skip areas. And depending on how her skin's reacting, you know, I typically will do 2 passes. And the first pass, I'll go, you know, in one direction. And then with the second pass, I'll go perpendicular 90 degrees. And that way, again, we don't get a chance of any footprinting or missing any areas. And in terms of how much gel to put on, I mean, you don't need to do a ton. Sometimes if there are areas, like in the temples, if someone doesn't have a lot of volume in that area and it's, you know, a little bit hollow, I might put a little bit more in that area just so that the sapphire tip, you know, makes really good even contact. But, you know, just enough gel so there's a, you know, a nice glide between pulses. Okay. All right, so we're going to start with a 580 nanometer handpiece, and then the next thing we have to decide is how strong a setting to do. And so I like to always look at how the skin is reacting. So I'll start with one number, and then I go up on the setting based on what kind of reaction I'm seeing. And the endpoint I'm looking for is really just a little bit of almost like a graying or darkening of the brown spots, and then, you know, sometimes a little contraction or bluing of the blood vessel. And so in this case with Christine, again, I'm going to start conservatively for the first few pulses. So I'm going to start at like a 9. The next thing we have to decide is the cooling. So pretty much for everything, you're going to use strong cooling. Sometimes if I have a really light skin patient that has a very light tan, like macular SK, and I'm just not capturing it enough with going up on the energy or the fluence, I'll bring the cooling back down to normal, just so I'm not protecting the epidermis as much. Or if I have some really fine little telangiectasia or dilated capillaries that are constricting from the chill tip, then I'll go to a normal cooling, but typically in just certain spots. So strong cooling is always your safest bet. And then in terms of the pulse width or the pulse duration, that's the amount of time that the energy is being delivered over. And so think of it as a very short pulse width. It's like a bang. It's like throwing a dart right at the center of your target, whereas a longer pulse duration is a more gradual heating slowly. So sometimes if you have a bigger structure like a blood vessel, that you need to gradually heat up and maintain that heat a little bit longer, as opposed to a little pigmented freckle that you're just going to hit and shatter. So that's how I determine, you know, short or long pulse duration. And I tend to like to start with short. Even with her skin tone, I mean, she's light enough to do short. Again, sometimes in someone who's maybe a little bit darker skin type or melasma prone, to be, again, more conservative, you could start with a longer pulse duration. So we're going to start with a 9 joule per centimeter fluence, cooling strong, pulse width short, and you have choices in terms of how fast your pulses come out. I do like to put it on fast mode, but you know, when you're first starting, you can go at the slower mode, or you can even turn it, you know, off, and just you control it with each finger push. So this with the LUMECCA, it's not a foot pedal, it's a finger trigger, and so with each pulse, I'm just going to, you know, push on that trigger. So we always keep the machine in standby until we're sure that everybody has their protective eyewear, that the door is closed, the sign is on the door, patient has their goggles, and that everything is ready to go. So Christine, I'm going to start over here on the area in front of your cheek. And so we're going to start with our first pulse. So here we go, 1, 2, 3. Okay, are you doing okay? So 1 to 10. 10's the worst pain of your life. How bad? A 1? Okay, great. And so we're doing Christine's treatment today without any numbing cream. And so, you know, many patients like to have numbing cream, but truly it's not that bad. So for patients who want to do it without numbing, or they get irritated with numbing cream, you can do it without numbing, especially if you're doing gentler settings. Okay, so I'm just going to take a look to see how she's reacting. So I think we have a little bit of room to go, because I'm not really seeing yet much in the way of darkening. And you know, when you first start, I mean, you can give it a couple minutes to see how it develops. But just looking at this cheek, I think we can go a little bit stronger. I mean, I'm seeing a little bit of it lighting up here, but I'm going to go a little bit stronger. So instead of 9, I'm going to increase the fluence to 10. And then I always like to record the number of pulses I do for every setting. So that way, you know, when we have future treatments, I can kind of look and see how aggressive I was. So we're going to do 15 pulses at the 9 setting. And now I'm going to hit the counter reset so that I know that we're going to go up to a fluence of 10. I'm still going to keep the cooling strong and do a short pulse width duration and the fast pulse mode. All right, so Christine, let me know if we need to adjust anything. Oops. All right, so we're going to come in the other direction now. So here we go, 1, 2, 3. Doing okay? Mm-hmm. Good. So I'm just marching edge to edge, and the crystal makes a little footprint in the gel, which is nice. So it gives you an idea of where you've been and where to place your next pulse. And so I'm not pushing real hard into the skin. I mean, I'm literally just making enough contact to feel like all 4 corners have contacted the skin, and that looks great. You're doing okay, Christine? All right, so we're gonna keep going. So the question always comes up as to, is it okay to use lasers over a mole? So if someone has a pretty deeply pigmented nevus or mole, I'm not particularly a big fan of lasering right over that, mainly because if that mole were to undergo some changes down the road, you know, we use the surface features and characteristics of a mole to kind of guide us in our decision making. So I know some people do like to laser benign looking moles, but in general, I try not to. So I use this procedure more for freckles, lentiginous, macular SKs, active acne, post-inflammatory pigmentation from acne, blood vessels, rosacea, angiomas, scars. And so I often will tell, in fact, I always tell the patient when we're doing it on like macular SKs, because a lot of patients don't know the difference, of course. And so I always explain to them that a macular SK has cells in it. It's more of a true cellular structure. So I can lighten it, but it may not come off 100%, so their makeup still may catch it a little bit. And so that way, again, setting up the proper expectation up front, and I've always try to take, especially for IPL, before photos, because often patients don't remember what they looked like before, and they'll come in and they say, oh, it didn't work, nothing happened, and then you bring up their photo and they're like, oh my gosh, I had no idea I had that many spots. And because patients are really used to looking in themselves from the front, not from the sides, and so when we take photography, we're doing side views, straight on views, different angles. And so when we point it out to them, then they're like, oh, that was so worth it, you know. All right, so I'm just going to take a look to see how she's reacting. And her skin's doing really well. So now we're just going to do the second pass on the remainder of her cheek. You're doing okay, Christine? And so, you know, the other beauty of this device, 13 years ago, my original photofacial machine died, and I desperately wanted to find a machine that I would love as much as that one, and I actually have to say I found one that I loved better, and for a couple of reasons. One is the handpiece is very ergonomic. I don't have a very large hand, and so this one does not feel overly cumbersome or heavy or bulky in my hand. And they've really designed it well with this curve so that even when you get into the neck area, the curve, you can still see the crystal. So you can see where you are so it doesn't block your view. And with the large spot size and the sapphire chill tip, I mean, it's much more comfortable for patients. It's pretty fast and efficient. And so it really can, you know, this has become like my favorite procedure. So when I get into the side of the nose, I like to do a little bit of an angle against the nose to try and get those capillaries. So we're just gonna put this here. Okay, it's gonna be a little pinch on the side of the nose, Christine. And then I like to do perpendicular to it to kind of catch the little vessels that branch off the side. Great. How are you feeling? Fine, good? Yeah. Okay. So we're going to come across the chin. Good? Okay, so now we're going to come into the other side of her cheek. Go ahead and turn to your right, Christine. Perfect. And so again, with the little sideburn hair, so you want to try and avoid that. All right, so we're going to start in front of your ear. Here we go. So So the same kind of thing on this side. And sometimes patients will ask, what's that burning smell? Sometimes the little vellus hairs on the cheek, you know, you will, or the upper lip, you know, it will burn a little bit and you'll smell that, but you know, you're not trying to singe their eyebrows or any other parts of hair, as we discussed. So one of the things that, you know, again, just kind of going back in the before and the aftercare, I will never treat a patient that is tan. And so I make that very clear at the consultation that patients have to schedule when they're committed to staying out of the sun for 4 weeks before and after treatment. And so, you know, I'm in Southern California, people are outside a lot. Often we'll do the majority of these types of treatments, you know, fall, winter, and early spring. For the patients that are like me that, you know, hide out of the sun and wear a little burqa all the time, you know, they can treat through summer, but anybody who's even going to be out a little bit, typically they're going to come in too tan. And so that's one of the most important things to screen for. We always screen for any history of cold sores. Anybody who has a history of cold sores is going to get antiviral prophylaxis. And for IPL, I typically do it for 5 days since it's a non-ablative procedure. Okay, so we're going to come up into this area. 1, 2, 3, little flash by the eye. And I also warn patients that even though the goggles are on, they're going to see some transmitted light through the bone. So I'm going to do a little bit here. Because sometimes, you know, that could make someone a little bit nervous because they're seeing that flash. But I always tell them your eyes are protected. This is just a little bit of transmitted light through the bone. And so, you know, not to be alarmed. And especially up on the forehead, sometimes that becomes even more of an issue. And I always like to do like a little blending in the jawline. I mean, Christine has such beautiful skin, you know, she barely has a mark. But for patients that, you know, do spend more time in the sun, you know, you don't want to have that cutoff sign right at their jawline. So I will do a little bit like right under the jaw as well. So I'm just going to go on top of your nose, Christine. 1, 2, 3. And I'm just going to push your nose to the side. And again, you can see with the nice angle that they cut out here on the handpiece, you know, you're not knocking into their nose, you're not pushing against their eye. So that's a really big plus. And because the intensity and the power on LUMECCA is so strong, I mean, truly, with my original device that I had mentioned, it was not uncommon where I would do a photofacial and then, you know, a month later I would bring them back in to get some of the residual telangiectasia, especially around the nose. And with the LUMECCA, with the high peak power and the shift into the vascular spectrum, I mean, I don't actually do that anymore. So that's been a huge benefit as well. So we're just about done on her cheek area. All right, now I'm going to come up into the temple and then forehead. And again, just be real good about staying out of the hairline and out of the brow and away from her tattoo. I'm going to put a little bit more gel on her forehead. So sometimes because the curvature of the forehead and you're trying to get a flat, you know, crystal to be in contact, putting a little bit of extra gel up in this area does help. Go and look straight ahead. You doing okay with the little button, or do I need to adjust that in the back? You're okay. So the other thing, if you are using numbing cream, so I typically will use like a triple numbing with betacaine, lidocaine, and tetracaine. And so it's really important when you remove the numbing to make sure that you remove all of it, because sometimes if you don't, prep the skin fully and get all the numbing off, then when you put the cold gel on, you'll see that numbing again as white on the skin, and you don't want to fire through the white, you don't want to burn the numbing cream onto the skin, so you just want to always make sure to, clean the skin really well after you've had the numbing cream on. And I'm really just floating again in the gel. Go ahead and just turn to your left. Great. And then turn to your right one more time. So again, to avoid any little skip areas, because once patients start focusing on their brown spots, they truly, if you miss one brown spot, they will come in and let you know. So you want to really avoid any chance of any skip areas by treating the whole face. And even like in the temples, I just move the laser goggles, the little strap to the side so I can capture that. So Christine got a nice first treatment. How did that feel for you? It was fine? Good, good. And so her brown spots are getting a little bit darker, and so that will continue to darken over the next 24 to 48 hours. And that's exactly what I want. A little bit of redness, a little bit of that darkening. And then next time, if she feels like she needs an additional one, then we can go a little bit stronger as long as all the other parameters are fine with sun exposure. So we just finished with Christine's treatment, and basically you can see already that she's getting some really nice darkening of the spots on her skin. She even had a little cherry angioma under her eye that darkened, and so that's gone. She had a little bit of inflammatory pigment on her chin that we treated as well. From prior acne eruption. So this is a really great first treatment endpoint. And then, we'll see how she does over the next 4 weeks and whether we have to, do a second one or not. But I think she's going to be really happy. So I'm just going to remove the clear ultrasound gel. And then, this is usually when I'll talk to the patient about their aftercare, reminding them again, strict sun avoidance. And I do like to be very specific about the type of aftercare creams that they can use and the ones I don't want them to use. So I like things that, gentle cleansers, nothing with glycolic or salicylic until, the skin is completely healed, typically, 5 to 7 days. And then I use either something called Biafine, which is like a French healing cream. It's by prescription, or you can carry it in your office. It has an avocado oil base, and that's pretty much what I'd been using for years until the elastin line came out. And now I'm using the Regenerating Nectar, which is an anhydrous peptide gel. Patients love it. It's silky smooth on the skin and really helps to heal them faster. But again, if they don't want the expense of that, Biafine is great. I'm not a big fan, and most of my patients don't tolerate having Aquaphor on their face, or being greasy for, a week, and I don't really think it's necessary because remember, this is non-ablative, and so we don't have to put anything greasy, and, we certainly don't want to clog their pores as well. So I'm just going to go ahead and take off the gel, and then I like to use a little Aven thermal spring water mist to cool them down. So we're going to do a little bit of that as a compress. Sometimes we'll actually create a mask out of gauze and let it sit on the patient's skin for 5 to 10 minutes. But Christine is not overly red, so I think we'll be fine with just doing it this way. We have lovely Julie here who volunteered for me to do a treatment on her neck and chest today. And, you know, Julie's grown up in Southern California, had a lot of sun exposure in her lifetime. She's lived in beach communities. And, you know, she's always wondered why she's so flushed. And so she has a combination of rosacea and some changes on the chest, just like we all get from just like walking from our car to the building or driving when you're light-skinned, getting those dilated blood vessels and the diffuse redness and some sunspots. So she's never had IPL before. And so today what we're going to do is we're going to treat the side, the neck and chest, and I'm going to even blend a little bit into the jawline, so that way she doesn't get like this sharp cutoff. And I'm going to blend back here behind her ear and in her neck, so she gets this nice even area. So it's not going to just be like lighter here and red there. We've already prepped her and cleaned her with alcohol and some Zephyrin and some hypochlorous acid, and I degreased her with some acetone. She's got her laser goggles on. I'm going to put my goggles on, and then we're going to get her setting. So when you treat the chest, you know, chest and neck is definitely more delicate skin than the face. There are not as many hair follicle structures, and that's how our skin heals after all of these different procedures. And so we're going to start with a more conservative setting also because she is quite red. So she does have quite a bit of target in her skin. And again, remember the IPL is going to be that energy absorbed into the target. So the bigger the bullseye, the more heat it's going to absorb. She did sit with some numbing cream because again, it's her first treatment and you know, want to make her comfortable. So I'm going to pick a fluence with her today of 10 joules, which is again on the more conservative side, but a good starting point on the chest with strong cooling and a short pulse duration and a 515 cutoff filter. So it's going to be the 515 handpiece, and I'm going to do very tight overlap so we don't have any skip areas. So Julie, you're going to feel little kind of cold from the sapphire crystal, and then you'll feel some little teeny bit of heat. You may see some bright flashes of light, but your eyes are fully protected. So we're going to start over here on the side of your neck, and I'm just going to cool this a little bit. And so when you're treating superficial telangiectasia and capillaries in the skin, you don't want to push your handpiece in and make an imprint, right? Because now you're blanching out the capillary and removing your target. So you're literally just lightly floating the handpiece onto the skin so that you have full contact, but that you're not compressing away that blood, because that's what's going to absorb the energy. So here we go on the count of 3. 1, 2, 3. And we're just going to march across this area. And I usually will do, you know, 3 or 4 pulses and then check and see how she's reacting. And I can see that already some of the pigment is reacting, so I'm going to continue with this setting. You doing okay, Julie?
Yep, I don't feel anything.
Oh, great, great.
So if you were to treat a scar, when would you start the treatment?
Uh-huh.
And how many treatments would you tell them to expect?
So, you know, some of the data with pulse dye lasers, you know, shows that the earlier you start the scar treatment, the better, because it helps with the collagen remodeling. So if it's a surgical scar, I like to just wait until there's complete, you know, epidermal reepithelialization along the scar line. So once they've had their stitches out and there's no little dried crust residue and it feels like a smooth pink scar, I think the sooner you start, the better. A lot of times if patients come in and they've had like an old traumatic scar that they want to improve, sometimes with the IPL it's nice because they'll have a combination of some post-inflammatory hyperpigmentation as well as the dilated blood vessels. And I'm sorry, was there another part of that question?
So you'd probably wait 2 to 4 weeks, and then how many treatments total?
Oh, okay,
would
good.
you
Lift
tell
your
them to
chin,
expect?
Julie. So, you know, again, for scars, I always, whenever it's anything vascular, just kind of back in my typical like pulse dye experience, I'll always quote 3 to 5 treatments because, you know, you never know. Like I'll say it could be 3 to 5. Some people get away with 3, but just so they're prepared. And for scars, I do typically use more of what we call a purpuric setting. which means I'm going to use the shorter pulse duration. I mean, if there's a very large blood vessel, then I might use a longer pulse duration with the 580. But I would typically, if they were lighter skin, start with a 515 handpiece. And, you know, probably start with 12 and then go up to 13, 14, 15. I've even sometimes gone up to 16 or 17 joules. How are you feeling, Julie?
Right?
Good.
Nothing.
Great. So I'm going to basically come down all the way from her jawline to kind of that upper portion of the breast, because, you know, when women like to wear like a tank top or a lower cut top, you know, you don't want to see that cutoff. And, you know, I like to do a stamping technique with the IPL. You know, you can hold your finger down on this handpiece and do more of a gliding technique across. And I know some of my colleagues definitely do that, and, you know, that probably can be faster. But I just like to be really careful with my placement, because I have had a patient, very fair-skinned, freckled redhead, of course, dear friend, it always happens to your friends, that got some pretty bad striping on her arms, even though I was so tight. And it was interesting, you could only really see it from her view. Like when I looked at her arm, looking from her hand up, you really couldn't appreciate it, but it drove her crazy. And when I looked from her view, I could see it. So I saw what she was seeing.
So our next question is, can you treat dark circles with LUMECCA under the eyes?
So dark circles, again, a very challenging problem. You know, they're multifactorial. They're from the shape of the eye. There's genetic factors. It can be from congestion, from allergies, venous accumulation, lymphatic accumulation, pigment. I mean, there's so many things that contribute to a dark circle. And so, I mean, again, you've got laser goggles on them, so it's going to be hard to get that tight. If you were going to try and go up that close, you probably would want to put eye shields in instead of using goggles. But I don't think you're going to get the result you're hoping for, because, again, to deal with all of those factors, I mean, you might get, if there's freckling or a little bit of pigment, you might get some improvement that way and a little bit of, you know, skin tightening. But that's where I would do things, you know, more like in the Morpheus range, possibly, you know, then followed by some filler, or if the patient really wanted something more, you know, more of like a CO2 fractionated laser. But it really just depends on their skin type, because of course if they're darker skinned, which that's a lot of the patients that do have the really dark circles, then CO2 is not going to be a great option. So I'm pretty much doing like 2 passes. And I came in, like I said, in this area behind her neck. And she's getting a nice little kind of slight darkening of her brown spots. So I always look to see whether I need to go back on some of them and treat a little bit more. And she has some angiomas right here. I'll see if this setting is strong enough to get those angiomas. 1, 2, 3.
For my education, Dr.
Uh-huh.
For angiomas or any other areas that you want to focus on, do you just do more passes or do you change the power? What's your
So sometimes I'll change. So basically, if I see that I'm liking the reaction she's getting at the current setting, then I'll keep it and test it. And on the one I just did, it actually did give like a little bit of a darkening purple color. So that's the other thing. With vascular, your endpoint is going to be, depending on how strong you're going, either immediate, you'll see immediate kind of clearance of the vessel, or you'll see like a gray bluing, and then it'll kind of come back. And then other times you'll get like a little purpuric, you know, purple bruise. So on her angiomas right here, I might end up going up a little bit higher. Like right now I'm still being super conservative at 10. But yeah, I'm going to go up a little bit higher and setting. So, Lisa, we did 127 pulses at that setting.
Hi, so this is another lovely patient that has volunteered to let us do a treatment on her hands. And actually, she's quite experienced with the InMode technology. She had started originally with some Forma on the face and neck, and then after that ended up doing some IPL on the face and neck, then some Fractura, and then most recently Morpheus. So she's been very pleased with her improvements. I know she's all covered up, so you can't see that part. So now that we've been doing so much improvement on the face and neck area, we're moving into the hands. And with Hilya, I mean, the thing that we talked about this morning is because she does have, you know, quite extensive pigment going up her whole forearm and up to her shoulder, she's definitely the type of patient that eventually we're going to end up doing hands, forearm, and her upper arm, and probably also the chest, just to get that nice even blending. And if I have a patient that says they always wear long sleeves, you know, we'll do the hands, and then we'll feather into the wrist so you don't get a real sharp cutoff. And if it's someone that likes to wear 3/4, but for anybody who likes to wear tank tops, you know, you don't want to have, like, you know, this pristine white skin or spotless skin, and then suddenly you've got the spots. So given that, and also because she's a painter, I'm going to be a little bit conservative with her hands today. Again, hands are very delicate. And so the skin on the hands tends to be very thin. People knock their hands on things. They're putting their hands in their pocket and their purse. So you don't want to take any chance of, you know, burning the hand or causing any problem. So normally on the hand, I probably would start with like a fluence of 8 and then work my way up, seeing how they were reacting, and, you know, treat somewhere between 8 and 10, occasionally 11 or 12 if someone's really fair. But again, because she's, you know, got a little bit of like diffuse brown from kind of actinic bronzing, I'm going to start really conservatively with her, and I'm going to start with like a 6, and we're going to see what the 6 does. So we're going to do a 515 cutoff filter because, again, she's type 2 skin, and we're going to start with 6 joules, and I'm going to do strong cooling and short pulse duration. You know, short pulse duration is great. Like I said, just really get that fast bang to the pigment. It's a great treatment. And so then we're going to just do a little stamping technique. Everybody's goggled up? All right, so Hilya, I'm just going to hold your hand, and then I'm just going to do the first pulse here. So I always like to just let them feel the chill tip a little bit, you know, for all of my cooling devices, you know, just so they're not shocked. All right, so then on the count of 3, 1, 2, 3. First pulse. And you can even hear the little snap pop of the superficial pigment. And so the minute I hear that, I know that I'm delivering enough energy to at least a portion of the spots. So I'm just going to do 2 little rows here. And again, I'm just kind of marching across. You know, a lot of us lose the fat in the back of our hand, and so I like to hold the patient's hand and kind of push the fleshy part up, just so I have a little bit more of a contact, as opposed to trying to just go against, you know, a bonier area or an area with tendon. And, you know, when you're working over bony prominences, whether it's on the face or other parts of the body, that can sometimes be a little bit more sensitive, so you might have to turn down your energy a little bit. So I'm going to just take a look here. So some of her spots are already lighting up. So I think I'm going to stay with this setting. And often you'll find that when you do your first pass and the target has gotten a little bit darker, then when you go over with your second pass, it's as if now you've got an even darker target for the IPL to hit. So you often, you know, can just, if you're seeing, you know, some reaction, then you can stay at that setting. And again, as you're checking back, if there's 1 or 2 spots that are just not reacting, then you can adjust. And again, I'm just doing really tight overlap. Some patients who have the really light tan, like macular SKs, those can be a little resistant, and so I will often turn the cooling to normal for those, and then I play around with short versus long pulse duration to see which is helping. But I always warn the patient that I can lighten up the color But I'm not getting rid of the cells because, again, this is non-ablative. This is not Fractura. This is not Morpheus. We're not, breaking the epidermal barrier at all. So if it's, something that bugs them because they can still feel a little bit of the texture, then we do something else, either a little liquid nitrogen or something else. All right, so I'm just going to rest her hand there to feather into her wrist. How does this feel, Hilya?
Feels great.
Good, good, good. So again, she did sit with numbing. Some people can do it without numbing, so, either way. And I always like to go into the fingers because you don't want to have, these nice back of the hands and then spots on your fingers. Lisa, did you have any questions?
No,
Yeah. Okay.
You're doing too good of a job explaining that, Robert. No good deed goes unpunished.
There you go. All right, so let me just take a look and see. Yeah, that looks great. And so again, because, Hilya and I talked, and again, always talk to your patient, that she would prefer to just, be a little bit gentler this time so it's not like every spot is gone compared to her forearms until we start, working our way up. And so I can already see, like right here, you can see the darkening in these areas, which that's a great endpoint for her. So I'm just going to finish up on the fingers. So I'm just going to spread my gel down into that area.
How far distantly can you go on the digits?
I go all the way down. I mean, if they're feeling sensitive, then, I can always turn down the energy a little bit. But like in her case, I mean, she's got these freckles and lentiginous, all the way down. So I'm going to go all the way to, and I just kind of felt that little pop of the pigment on that one. So again, affluence of 6 is really quite low. 5 is the lowest. And so because she's fairer skinned and she's got a lot of pigment, you don't need a lot of energy. So, she's the type of patient that if you went too high, you could potentially overdo it. So you just always want to start conservatively. You can always do a second treatment. And I say that to patients all the time is, based on what I'm seeing, I believe I did, the proper treatment for you, but let's see how it goes. And if we have to, zap again, then we will. How is it on the fingers compared to the hand? Is it feeling okay, the same, or?
Perfect.
Great. See, I picked the perfect patient. And then I always like to kind of get in the little web space in between the fingers as well.
So once again, you can summarize your settings here.
So basically we're using a 515 nanometer handpiece, which for a lighter skin patient. And we're using affluence of 6, which is quite low. Often on the hand, it could be 8 to 10. Strong cooling to protect the epidermis, and a short pulse duration to really give it that, that kind of pow effect. And the more I'm even just doing a little bit more of a pass, it just keeps looking better and better. So, depending again on how conservative you want to be, you could turn it up a little bit, but I'm just really happy with how this looks. So my type A behavior sometimes gets the best of me, but I think this looks really good. So that's like exactly the end point. And she's really not even red, but you can see really nice highlighting of those brown spots. And now I'm just going to do a little bit more feathering into her wrist.
Be presentations.
Great, thank you, everyone.
Okay.
Thank you for attending. I really
Christy is-
appreciate it.
Yeah, signing off in Dr. Roberts' Southern California office for InMode live stream educational series. See you next time.
And the cruel, cruel mornings turn the days of swim or sink. Living right is easy. What goes wrong, you're causing it. Drown